Hi, I'm Dr. Rosie Roeder, board-certified plastic surgeon.
And I'm Andrea Spar, board-certified physician assistant in dermatology.
And we are the Rejuvaness Podcast.
Thank you for listening today.
Yeah, and today we're going to talk about my jam. We're talk about some surgery.
It's the Rosie show now.
Oh. I mean, as surgeons, not like we don't like the spotlight, do we?
Right.
Mm-mm. All right. So I did a video at some point talking about plastic surgery myths, and Andy was like, well, let's talk about some of that.
Yeah, I think it's very important for people to know what they're getting themselves into and what's really just not true.
Yeah. Hear all sorts of things and people coming in with information that they got, everywhere. From their neighbor, from their friends, family, the internet.
Dr. Google is their worst enemy.
Dr. Google. And now it's expanded to social media, IG, influencers, TikTok, right? You name it. I'm probably forgetting some platform. But there's information everywhere. And it's a good thing, and it's also a bad thing. We've mentioned in some of our other episodes how individuals are different, and something that was good for somebody else may not be good for you. But there are some myths out there that are really totally untrue.
Right. And I think the first one we want to talk about is all plastic surgery major surgery?
I think, yes. I think you should look at it as being major surgery. When we trivialize something that's purely elective, I think it's problematic. This is not something that you absolutely have to have. If we're doing something to change our appearance, it's not an emergency.
Right.
There's this, there's the definition of cosmetic is that there's no medical necessity to it. So we can never trivialize that. That means you're entrusting someone else with your life. Just because it can be done under local at times. Right? Or because it is about appearance altering doesn't mean it's not major. We do not necessarily always go inside body cavities, but we are making scars on the body. We are permanently alter physicality. We are putting people under general anesthesia, which changes their physiology. So look at it in your mind as I am undergoing major surgery. I'm undergoing something that is going to physically alter me.
Especially if you can't drive afterwards.
For my life, yeah. If you're not allowed to drive for at least 24 hours because of the anesthetic, then it's major surgery.
Yeah.
We try and to change that a lot. Like a lot of patients ask me, can I get this done under local? And the answer to that is sometimes is yes. But because it's under local doesn't mean that it's less. It takes me longer to do liposuction under local than it does to do liposuction under general, because I have to worry about patient safety. I have to worry about limits of local anesthetic medications.
Then moving.
Yeah, patient comfort, right? So when you have a blunt cannula and you're moving it around, if somebody's asleep, I can control that a little bit. I know that they're not going to all of a sudden be jerking where my instrument can go deeper than it needs to be.
Right.
So there are different consequences to it. And we are moving more and more to an environment where people want quick fixes over lunch, right? I think almost everyone now has heard about a lifestyle lift during lunch, and there's a reason why that company failed. And I've had really good friends who are board certified surgeons, who are great surgeons that participated in that in the beginning. It just, in the end, just doesn't deliver the same amount of results.
Or longevity.
That's right. You can't go into some of these deeper planes like safely if somebody is not asleep at times. So I do offer certain things under local, but most of it is under general anesthesia, just to keep it safe, keep the surgery a little bit more controlled.
Well, and with any surgery, you're going to have a patient that comes in and say, I don't want scars.
Right.
So that's our next myth. Are there scarless surgeries?
Well, if you are a fetus under the gestational age of 26 weeks, yes. That is the only time where the hyaluronic acid in the body is so high that you'll probably heal without a scar. But, after you're born, you get a scar one way or another. Some people heal really well and they don't have raised thick scars. And that's what we aim to do, is just to try to give our patients the best surgical technique as well as the post-operative treatment to minimize that.
Right.
So it's a trade-off. Okay, if we're going to do surgery on you, it's going to be at the expense of something, and that's going to be a scar, whether it's a small one or a bigger one that, depends on the type of surgery that you're having. But I've never had anyone come and ask me to give them back their droopy boobs or their little bulge. Right? They all accept the scars once they see the ultimate results. And again, we help with a lot of our post-treatment to minimize that.
And the people that have a history of keloids, like how do you walk them through that and what to expect?
So it really just depends on what they mean by keloids, right? Because there are people who are keloid formers and some that have hypertrophic scars, and that gets a little bit confusing. So keloids mean scars that go beyond the border of the cut that you made. And I tell them that if that's how they heal, that might be how they heal.
Right.
And all we can do is technically address the ways to make that less of a problem and pre-treat or post-treat the skin. Use injections with Canalog or other steroids or 5-fluorouracil. And sometimes if we're treating keloids a little bit different because we can use radiation and things like that.
Right.
But a lot of it's taking out the tension and making sure that it is a very well opposed surgery. The skin comes together in a way that facilitates healing and doesn't give cues to the body. But yeah, it's a problem.
Yeah.
It really is a problem, and it's hard to fight that at times.
And I tell everybody, you can have 27 scars and only 2 of them become hypertrophic or keloid. They may not all do that.
Right. And there are areas in the body where that is more prominent, right? So the chest area can have more hypertrophic scars, and that's really hard for women, especially because they have like lower cut shirts that they might want to now use. So anytime I'm taking like a mole or a skin cancer out of the chest area, I usually warn patients about that. It can sometimes hide where these scars are, trying to minimize it. I try to stay away from flexor surfaces, and then post-operative support. You can get hypertrophic scars or keloid scars because the body's trying to heal something. So if there's a lot of movement in an area or a lot of movement towards that, or the skin pulls, I tell my patients, for example, that I'm doing reductions or lifts on if they have a wise pattern scar, to wear a compressive bra, especially at nighttime, because if the body's moving and the weight of the breaths move lateral, it's going to pull on that medial scar. And I see that quite a bit. So it's about giving them some tips of to how to minimize that.
Okay. And then like looking for like weight loss procedures and stuff, people come in and say, I want liposuction because I want to lose 50 pounds. Is that legit?
No.
I figured.
Now, you can take a lot of volume out of someone,
right?
But it can be dangerous. So whenever you are taking out fat, you're also taking out blood and fluid. And our body really tightly regulates fluid. So if you're going to take more than 4 to 5 liters of what we call lipoaspirate, right, which is a combination of fat, blood, and fluid, you really need to be in an overnight facility, and you need to have your vital signs monitored. And it's very unfortunate that somebody has a complication from that. I mean, you can get very dehydrated. Those fluid ships are bad. The most severe thing that can happen is swelling of the brain and herniation of the brain, and that's death, right? So a lot of states have a limitation of what you can take in terms of volume in the office. And we in our practice do office-based surgery, meaning you will go home after surgery. So we like to keep it, or at least I like to keep it at 4 to 5 liters max, just to make sure that it's really, really safe. And I tell my patients how to hydrate prior and after and what signs to look for. Right. But if you're somebody who really needs a higher volume, you might really need to lose weight before surgery. And I think people are more successful if they're close to their goal weight, and so that you can get the contouring for the liposuction.
Right.
Or if you really need a lot more volume, then you need to go somewhere where they have an overnight facility just to make it safe. But when you think liposuction, think body contouring, thinking about resistant areas where diet and exercise can't hit.
Now, is there an ideal candidate for liposuction versus switching and saying you really just need skin tightening?
Yeah, I've had a lot of young women who have concentrated areas in their flanks or maybe in their bellies, and they are active. They are of normal BMIs, and those are patients for which liposuction is really great, and they do phenomenal. They have amazing results. And then there are people who have some skin laxity. They've had maybe pregnancies, they have striae or stretch marks. And any skin that has had stretch marks, it doesn't have the same elastic recoil. It's not going to bounce back. It's a permanent break in the dermis. So for those patients, they might be a better patient that's suited for a tummy tuck,
right?
Because they need that skin, especially in the bottom portion of their belly, to be removed. And a combination of liposuction and tummy tuck is a great procedure for the right patient.
Well, I'm not gonna lie. I have multiple treatments with liposuction, and even though I've worked in plastics in the past, I am that person that got on the scale the next day to see if I lost any weight.
Oh, so I had liposuction too. My plastic surgeon is phenomenal, and she is one of those pioneers in doing things under local anesthesia. But there are other adjuncts there to make it kind of comfortable as well. But she's phenomenal, and we were in office. We took less than 4 liters, and for 2 weeks you don't see any change, right? If anything, you might see weight gain. And I tell my patients that do not get on a scale for 2 weeks. You might even see weight gain because of the fluid shifts and the fluid retention. So give it time.
I know we're our own worst critics again, and having that history, I already know that, but I still did it.
Yeah. Well, I was probably not necessarily the most ideal liposuction patient, but being in this profession and having friends, you can get them to sometimes color in the lines. But I had gone through having to have a hysterectomy after having severe uterine bleeding and be put on tons of hormones.
Right.
I got pumped with 3 birth control pills a day, and I gained a significant amount of weight within a span of time. And at some point I decided really I got to do something about this. So I started to change my diet and exercise, and I had lost 14 pounds. And that's when I went to Dr. Gruber and I said, hey, I really need some help here to touch up some areas. And she said, okay, let's get you started. So I had my liposuction, and after a month of healing, I went back to the gym and I was a different person, because all of a sudden my little fat rolls didn't roll over my gym pants, and everything felt more comfortable. And after I lost another 15 to 20 pounds, but it wasn't because the liposuction took that away. It was because it just got me so much more comfortable with myself that now I could continue on that weight loss journey that I was already in and on my fitness journey. So it helped me tremendously to kickstart that. But I did have some excess skin because I had babies, and it's sitting there, and our plan was massage that skin down, and if it becomes an issue, we remove it. And it's been 4 years and I haven't yet felt the need to get that skin removed because I'm happy with myself. But there's other things with liposuction too, like irregularities that you have to accept. But I haven't gone through the process. I think I can advise my patients a little bit better about it.
And I think, like I said, even with my liposuction, I think that Dr. Butala gave me that confidence that I needed to get back into the gym. Like you were saying, if you don't find me here, you'll find me at Pilates right now, trying to tone things. And I think that was just a nice jump start, knowing what I know, to kind of keep going with it. And my contour has never looked better. I am 36 and I have never had that hourglass waist that I have now that he's helped me with.
Right. And that's exactly what it's for. It's to build that shape.
Right.
And defat a little bit, right? Oh, the other thing that I get on the liposuction myths are, can I never gain weight again? Or what happens if I gain weight? Well, the fat that I took out, it's in the bucket.
It's gone.
It's gone. That fat is not there. But the way fat cells react is that they enlarge. They don't multiply.
They just swell.
They just swell up. So whatever is left, and there's no person out there, and it's impossible to take away all fat cells. I mean, there's a good reason you have fat. That padding is there for a reason. It regulates temperature. It provides a buffer to your skin and your muscles and your soft tissues. There's good reasons why fat is there. So we're using a blunt procedure to remove a certain amount, but we're not going to take out all of it. So whatever remains, it can swell. it can enlarge. So yes, you can gain weight. You can gain weight in areas you've had liposuction, but I'll tell you that at least my personal experience with myself and my patients is that you tend to gain weight more in other areas that haven't been liposuction than in the areas that you have, which is why BBLs, by the way, are a procedure where people are super happy to gain 10 pounds after their surgery, because wherever all the fat got removed,
it got put back.
Where it got put back on the bottom. It swells more on that bottom that's been replaced. And on the places where the liposuction was done more aggressively, they're going to end up getting an augmentation to their already augmentation. Yeah, exactly. So that's why it's so great.
Right.
Yeah. But a lot of body contouring patients do gain weight afterwards, especially if they weren't in a good routine beforehand. So I just pay attention to what people were doing before and tell them that they have to maintain that. There's only so much that I do. Right. Like there's what you do as a patient, what the surgeon does as a surgeon, and then the patient has to maintain that over time.
Right. Now, are there any other myths, but even with like breast implants, that you get a lot of?
Yes. Well, there's a lot of things going on the breast implant realm that we can talk about.
Right.
But the main thing is that they come in cup sizes. So they don't come in cup sizes. They come in millimeters. So it's a volume based. The way our breasts are measured is based on your bandwidth and then in the highest projecting portion. And people have all sorts of bra sizes that are wrong all the time. I think women are super guilty of not really knowing what their bra sizes were. Some of them have given up on bras and only use a sports bra, so they don't know. They're small, medium, or large.
I think they don't even know they can actually go get measured for free at some of these department stores too.
Yes, and that they're sister sizes. So a 36C is equivalent to a 38B. So it just depends. So when you come to me and you talk about sizes, I always talk about sister sizes. I talk about, so as a reference, how much bigger would you want to be? Like if you're now a B, would you want to be a C or a D? Because in my mind, I know more or less how much the volume is going to be based on the bandwidth. And my rule of thumb is if your chest width is 38, bigger or smaller, then that volume changes. So when somebody comes to me and says, well, my friend had a 400 ml implant, I want a 400 ml implant.
So you can be the same size
So you
as
can
her.
be the same size or have the same look. That is not going to work. It's one of those things where your breast width is really important in deciding what that is. So it's a very individualized personal surgery, and we have a lot of ways to estimate what that volume is and what that's going to look like on you, either 3D modeling versus just literally stuffing a bra. I'm like, get this bra, we put sizers in there just to see what it would look good on you. And of course there's some science to it. There's some things that we follow, but saying, well, is that a C? And I said, well, I don't know, because that might be a C for Andy, but it might be like a triple D for me. It really depends on your individual characteristics.
Even then bringing in pictures, though, they bring in pictures of like supermodels that are in this tight top that pushes it all the way up, and they're like, I want that.
Yeah. Even when we have augmentation, we have upper pole fullness, there's a difference between how that looks when you're naked versus how that looks in the push-up bra.
Correct.
And people want to come in and have breast implants because they feel like they're never going to wear a bra again. Well, you can get away with that for probably a little bit of time, but we're all going to age. We're all going to have changes to our breasts that are related to life and life events, like pregnancy, like menopause. And so, you are going to change over time, and you can't have one set of breast implants is not going to last you a lifetime.
Right. And gravity pulls everything down.
Gravity pulls everything down. The other thing I get asked all the time is, do I have to change them every 10 years? So you don't have like a last day that this is valid. Like you put it in today, come back to me in 10 years. A lot of that goes based on the warranty that was given to implants.
Right.
So just like anything that you have in your house,
FDA
that's man-made.
requires it.
Well, the FDA requires me to tell you it's not going to be a lifelong device.
Right.
Which it's not, right?
But that's why there's expiration dates on water.
Yes. But it's in your body. What we go by is it still in good position? Is it intact? Are you happy with it?
Right.
So if any of those things changing, then definitely, you want to go ahead and switch your implants. We do screening for silicone implants starting 5 years At least that's the FDA recommended. After you've had them in for 5 years, then you screen them every 2 to 3 years with either an MRI or an ultrasound. But I have ultrasound in my office, and I can scan implants and look for rupture, and that saves the patient a lot in terms of having to go through a MRI, for example. If anyone has ever had a breast MRI, like I have.
I had one last year, and I knew you had an ultrasound, because I would have just come to your office instead of driving to get that done for my implants that are actually 12 years old this year. So
yes. So yeah, next time we can just do it, or we can show everybody what that's like.
Right.
It's an amazing technology. It's just in the office. It's minimally invasive. It's pretty accurate. There's going to be some new AI driven software with them, which is going to take even the ultrasonographer out of the picture. But I was trained in general surgery. I did a full general surgery residency before plastics, and we did biopsies under ultrasound guidance. We did central lines under ultrasound guidance. I've scanned so many abdomens for trauma with ultrasound that I'm very versed in the ultrasound world. I just had to learn how to use it to look at implants, and just a lot of it is just keep scanning. Go to courses, talk to your colleagues who are doing it, and just start scanning implants. You know, just like everything we do, the more you do it, the better you get at it.
Right.
And sometimes correlate. So if somebody comes to me with an MRI proven rupture, I ultrasound them so that I can know what it looks like. And then I scan a bunch of implants that feel normal, or implants that I just put in on patients. So that way I can see what they look like in the normal environment too, so we can discern that. But it's a great way to assess that, because if there is a silent rupture, which is common for silicone implants, then somebody can have the option of replacing it or not, because you get the silent rupture, that's why it's silent, before you get any symptoms that come about.
Now, are silent ruptures, I guess for generation 1 silicone implants that were more like molasses that was filling, those aren't so silent, are they? Because you can get those granulomas and stuff, right?
Those are not so silent at all. But we are now in generation 7 and 8 implants. There's no more liquid silicone. Almost every implant out there is cohesive. That's what we call them. Gummy bear is what I get a lot. So gummy bear is actually a trademark of a particular implant. We don't have a lot of those in the market anymore, which are the teardrop shaved textured implants, because of BILCL, which is a anaplastic lymphoma. That's a reaction to the texturing on implants. So I haven't used those in practice since I've been in practice. I use smooth implants for augmentations and even for my recon patients, just to try to avoid that. So that was sort of, the gummy bears came associated with those textured teardrop implants. But now what we have is highly cohesive gels. So if you cut into an implant, and I have some videos on my website of cracked or pictures of what they look, it's kind of like slicing into a gummy bear, but that gel just stays cohesive. It's not going to fly places.
It might ooze out a little bit, but it goes right back in.
Well, and they will stay contained within the capsule.
Right.
The capsule is the scar tissue that builds around the implant. It's a normal occurring phenomenon, right? It's like when you have a piercing and your body heals around that piercing. Well, that happens around any kind of foreign body. If you get shot with a BB gun, if you get some piece of wood impaled into it, it's going to form a capsule. A capsule is a normal body reaction. So that's what happens with implants. So, they don't necessarily come off the shelf in a cup size that you can order. They are not going to all of a sudden be damaged at a particular set amount of time,
right?
But they're most likely not going to last you forever. So those are kind of the biggest myths I see around breast implants.
Okay. And last but not least, what about the face? People that come in for these facelifts.
Yeah, I do a lot of facelifts now. I never thought that I was going to be a facelift surgeon, but I love it.
That's like your jam.
Yeah, I've been trying to improve my techniques and learn from people who are experts in the field. Everybody now is trying to go into a deep plane, which I think is amazing. And I just did a course on Dr. Cal's ponytail technique, which is amazing. It's a combination of using minimally invasive endoscopic. So when you're talking about scarless, it's not scarless, but these incisions are hidden within the hairline and in other places. And the biggest fear that my patients have is they're going to look like the Joker. They literally do this, and for those of you that are not seeing, I'm pulling my mouth apart, and they tell me they don't want to look like Kenny Rogers.
I heard Joan Rivers once upon a time.
Yeah, they want to have more of a natural look. And the main thing about a facelift is improving the jowls and improving the neck. If you improve the jowls and you improve the neck and their face goes to be a little bit more oval, which is what we look in restoring youthfulness, then you will do great. But not everybody's going to come out of a facelift looking like the Joker, looking like a caricature of themselves, and looking like they had plastic surgery. Right. But every surgeon has different aesthetics. So we all have things that do well in our hands. And there are people that want that. You know, there are some plastic surgeons that have patients that come to them and say, hey, I want to look like this. And then they do that for that patient. And then they become popular because that's the kind of aesthetic people expect or demand of them. Right. We're more in a rural area. So people want to look refreshed and they want to not look overdone. Correct. So at times I look at my before and afters and I'm like, that's good, but that's not a different person. And that's what the patient wanted, and that's what I deliver, so I'm happy with that. Are the results that drastic that now some 70-year-old looks like she's 30? No, but that's not what my patients generally ask of me. Right. They just want to look like they're not tired. They want to get rid of some of that skin on their neck. They don't want to see the bands.
They want to look good at their family reunion.
They want to look good at a family reunion. Right. But they don't want people to say, oh my God, that person had
a facelift.
Yeah, that person had facelifts. And they're always very scared of their cheeks and looking like they're going to look like Catwoman. And a lot of that is about going slow in the alterations that you make on someone's face, and that it's a process. Like a facelift is more than just taking out excess skin. You have to work on the underlying musculature. You have to replace the volume that's lost with aging. Right. And we're seeing that a lot too with Ozempic face. I think at some point we talked about weight loss in general, right? Right. We do lose some of the fatty acids in our skin that keep it plumped. We lose the fat pads in our face before we lose it anywhere else that we want to.
And that's going to be such a good future episode. And I think we can probably even go deeper into what a deep plain facelift is for some people. Because they don't know the difference.
No, we can talk about all sorts of different facelifts. I mean, we can bring a list here of where we go in planes and even show pictures associated with the video and kind of explore what that is so you know what you're seeing online. And I think it'll be a very important thing to do. But you know, you can safely get a facelift where you're not going to look like the Joker, you're not going to look like somebody that you're not, and you're not going to look like a fake doll, unless you go to somebody who that's what they specialize in, because that's what their population wants. But I hope we dispelled just a few myths. I know we went into several different topics that we can break down into episodes. Yes. So if you guys let me know what plastic surgery techniques or topics you want me to address in future episodes, I'll be glad to tackle them all individually.
And don't forget to kind of like, comment, share, let everybody know about us, and we'll keep bringing the episodes to you.
All right. Well, I'm Dr. Rosie Roeder, and this is Andrea Spar, and we're the Rejuvaness Podcast, and we'll catch you next time.